Well, in today's Health Alert, it's the first day of May, and that means it's Lupus Awareness Month. Lupus is a chronic autoimmune disease and just one of more than 80 autoimmune conditions that affect millions of Americans. A lot of people are asking, are the illnesses becoming more common? So here to answer that, our Chief Health Editor, Dr. Partha Nandi. And Doc, let's start with what lupus is and how it affects us.
It can be a tough disease.
Yeah.
So lupus is a long-term disease where your immune system, which usually fights off infections, right, Glenna, mistakenly attacks your own healthy tissues. And that can lead to pain, inflammation in places like your skin, joints, kidney, hearts, and lungs. So important places. Now, people with lupus often feel extremely tired. They have headaches, swollen or painful joints. Sometimes they have low fevers. These symptoms can come and go in what we call flares, in which can make it hard for people like me, doctors, to diagnose. As for what causes it, we don't actually know the exact reason, but factors like genetics, hormones, and certain environmental triggers are likely involved. Unfortunately, autoimmune diseases like lupus can have a huge impact, not just on the person, but their whole family. And I see it all the time in my patients where the entire family is affected.
Yeah, and we know there's different kinds of tumid lupus. And so what are some other autoimmune diseases, and are we seeing more cases of them, and is there a way to prevent it? Or?
Yeah, to me, it's going rampant, right? So besides lupus, some of the more important and common autoimmune diseases include multiple sclerosis, celiac disease, type 1 diabetes, psoriasis, rheumatoid arthritis, Hashimoto's thyroiditis, and I treat these diseases, Crohn's and ulcerative colitis. These are inflammatory bowel disease that I often see in my practice. As for whether autoimmune diseases are increasing, the answer is a resounding yes. Studies show that a rise of up to 12% every year, and if this trend continues, they could soon be amongst the most common health problems that we doctors treat. So why the increase, right? Well, these conditions are often very complex. There's usually a mix of genetic factors, but stuff like pollution, certain medications, toxin, viruses can also play a role. Also lifestyle factors, and this is what I think is super important, like poor diet, lack of sleep, not enough exercise, and stress can make things worse as well. Now, can they be prevented, right? People ask me that all the time. The truth is we don't fully understand what causes them, so there's no guaranteed way to prevent them, but making great, healthy lifestyle choices can help lower your risk. So if you're noticing symptoms like constant fatigue, skin rashes, digestive issues, hair loss, unexplained weight changes, joint or muscle pain, numbness or tingling, please talk to your doctor. Getting a diagnosis early is so critical, and then starting treatment can make a big difference. Most autoimmune diseases are chronic, but with the right care, many folks are able to manage their symptoms and live fulfilled, happy, full, active lives, so we can do something about it. Not all hope is lost, but we got to address it and address it quickly when you get the symptoms.
Be proactive about what you feel.
100%, and all that stuff I talked about, what you eat, how you feel, and decreasing stress, super important.
All right, Doc, appreciate it. Thank you so
my
much.
pleasure. Of
Good
course.
to see you.
Thank you.
This week on the Dr. Nandi Show, cancer doctors speaking with Dr. Nandi about the importance of early detection, treatment options, and survival rates for some of the most common cancers. Plus, a cancer survivor tells her emotional story of discovering a cancerous lump in her breast during a self-exam and shares her road to treatment and recovery. So tune in. It's this Sunday, May 4th, 1 p.m. to watch Stop Cancer Dead in its Tracks.